So let's talk about tantrums. So many parents, including especially, first-time parents, really don't like tantrums, whether that include, crying, whining, whatever sort of, kinds of behavior go along with their tantrums, right? But I want to offer a positive reframe here because tantrums and crying are one of the most effective and oftentimes only means of communicating for a lot of very young infants and some toddlers who are preverbal, right? So now nobody really wants to be experiencing a tantrum, right? It can be very unpleasant for your child to be crying. It's hard for parents to hear that. You also don't tend to want to be that parent in the grocery store with a child who's having a meltdown because they want the candy bar. But there are alternative ways of teaching your preverbal child how to communicate more effectively and functionally that do not involve tantrum behaviors. Now, this can include things like making choices, pointing, reaching, verbal approximations, or baby sign language. And I'll be going over some ways to kind of teach some of these functional communication methods later, but I also want to point out what happens to cause the tantrum is not actually as important as what happens after the tantrum. So what you really want to keep in mind is the consequences for the tantrum behavior. So for example, with the grocery store, are you walking out and leaving everything behind, or are you walking out and your child's getting the candy bar? So it's just as important what happens after the tantrum, because that behavior can either be reinforced, which is going to increase the frequency of that behavior, or if it's not reinforced, it will decrease the frequency of that behavior. So ultimately, what happens after the tantrum determines whether or not those are going to happen more frequently or not. And again, if you pair those really kind of thoughtful consequences with alternative replacement behaviors that are more functional communication methods, that should help to decrease some of these tantrum behaviors in your child and allow them to get their needs met, which is really the most important thing here.